Toniann Richard is the CEO of HCC Network, a group of 6 community health centers in Missouri. Toniann, good morning. How are you?
Good. How are you?
Good.
Thanks
I've been
for having me.
excited to talk to you because we've been hearing about the big, beautiful bill and the cuts, but I want to talk about how it's affecting real people like me and you. So this bill was signed into law 2 weeks ago. It's projected to cost rural hospitals nationwide more than $66 billion in Medicaid funding. That's just in the next 10 years. That's one estimate. So Toniann, give us a sense of what these funding cuts will mean for the 6 hospitals in Missouri that you oversee.
Sure. So there's a lot of, right now, 50% of hospitals across the country are already working on negative margins. And so when you put a strain on the payer system, such as Medicaid, you're going to see a lot of changes. Number one, leaders are going to have to decide how to fund that loss. And so is that a reduction of capital improvements, equipment changes, equipment upgrades, those types of things, additional services and specialties. And so we're going to see that. There's also obviously the concern of more people becoming uninsured, delaying access to care, and ending up in the emergency room where those bills are less likely to get paid. So the stress of the situation is real. And I think right now a lot of leaders are coming together and trying to figure out how we can coordinate and collaborate and come up with some solutions that are best for each individual's state and area.
And look, the number of Americans on Medicaid, it's huge. According to the latest federal data, it shows 71 million Americans are on Medicaid. 1.1 million are just in your state of Missouri, where health centers are located. Talk to us about how this law will likely filter down to the 1.1 million patients in Missouri. And that's just those are just the ones on Medicaid.
Right. So, I mentioned the 50% of all rural hospitals across the country are operating in negative margins. Missouri is going to be one of the largest hit states with this Medicaid reduction. We're looking at a 29% reduction in those covered. And so that is extremely significant for our state, putting 1/3 of our hospitals at risk. And so trying to find ways where we can make sure that patients are educated on their care, make sure that they understand where to get the information, stay up on it, the work requirements that will be implemented, making sure that they are compliant on that. So we don't have people being removed from the Medicaid system due to a situation like not being compliant in the program, and then just figuring out how to divert people to the right place in the right time to seek the care that they need.
That's quite an overhaul. That's an overwhelming task, and we're only talking about those on Medicaid. What will this mean for patients who are not on Medicaid?
Right, so it'll be compounded. More people will be seeking care in safety net clinics. Safety net clinics will be responsible for raising additional dollars to offset that loss of uncompensated care. Right now, uninsured rates in rural communities is already high. So when you look at adding 1/3 of your population to that's pretty overwhelming. The reality is, I heard somebody, a physician earlier, say policy does not drive care, and there's no truer words to that. People need to seek access, and they need to be able to get care. And just because they don't have insurance doesn't mean that they won't still need access to services. And so figuring out how to get people to places that they can be seen is already a challenge in rural communities. And if you close even just 1 or 2 hospitals that have clinics associated with them, or just hospitals on their own, you're going to reduce the number of places that people can go.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.